Hello friends, I'm Pratap Bhosle. Welcome you to Knowledge Institute. We have earlier started with the Pharmacist and Drug Inspector lecture series of Diploma in Pharmacy syllabus. We have already covered with the community pharmacy. From today we are starting with the clinical pharmacy subject. It's the second year Diploma in Pharmacy subject. Okay. So let's start with for those who wants to buy those books useful for Pharmacist and Drug Inspector exams, they can go to this link. I will share these links in the description from where you can buy this. Okay, this is my YouTube channel. You can also subscribe to TelGram channel whose description is in the link. Sorry, whose link is in the description. Okay, the first chapter is the hospital. The definition of hospital, you all might know, where the patients get treated, admitted. Okay, functions are various. Okay, these are the questions not which are like to be asked as a MCQ. The functions are getting patients admitted, giving him treatment, operations, surgeries. The classification of hospital, the clinical on the basis of clinical services, length of stay, and the ownership and the control. Okay, on the length of stay, if the stay is less than 30 days, it is called as short stay, and the longer stay greater than 30 days. According to the ownership and control, the government hospital and the non-government hospital. Out of these, most of you might will remember that the civil hospital are the government hospital, AIIMS, CGHS, military, corporations hospital, or a government hospital. But remember, this cottage hospital and the primary health center (PHCs) are government hospital. In the non-government hospital, all the private hospitals, profit and non-profit also, and the community hospitals. These are also comes under non-government. This is sometimes you may consider community hospital under government hospital. Okay, so just remember this point. Next, the clinic. What is the definition of clinic? The ambulatory patients are admitted for special study and treatment by a group of physicians. For special study and treatment by a group of physicians. In US, hospitals require license and recognition by Joint Commission on Accreditation on Hospitals (JCAH). What is medical staff? There are different terminologies used for the medical staff. Honorary, consulting, associate, courtesy medical, and what are those? Honorary is retired but active in hospital. Most of the senior doctors, even if after retirement, they remain active in hospital because of their experience. Second is the consulting, the specialist from various faculties. They are the consultant which comes to the hospital only for a fixed time period in the day, like 2 hours or 3 hours. The associate, the junior or less experienced hospital doctors, and the courtesy medical staff is the physicians who have the privilege of attending to their own private patients at the hospital. They are the courtesy medical. Medical record service, it is means of communication between physician and nursing staff. Okay, you must know that. Then the second chapter is the hospital pharmacy. The first North American hospital, the Pennsylvania Hospital in 1752. Jonathan Roberts worked in it as a hospital pharmacist. Okay, so Jonathan Roberts may be called as the first pharmacist. Okay, the American Society of Hospital Pharmacists founded in 1942. And the functions of the hospital pharmacist. The first one is obtains patient's medical history, gives information to the physician, assists physician in selection of drugs, dose regimens, participates in cardiopulmonary emergency, and many more. These are just few examples. Okay. Next is the personnel for inpatient. When I have read this point of functions of hospital pharmacist, okay. Although these functions are very much important in the hospital, but they are not actually pretty much recognized by the society, and we must work on that. Okay, the societies, many of the time societies, those people who don't understand the pharmacist profession, they don't consider that all these roles are done by the pharmacist. Okay, Many of the times they say the only function is that just to read the prescription and give the drugs from the pharmacy to the patient. But it's not that. You all know. And to some means only, actually, at least to some means we should work on this. Okay. So let's start with the next point. The personnel for inpatient services, hospital bed strength and number of patients. Actually, some sort of questions has been already asked on this, based on this. Okay, so we should at least remember this up to 200 only. Okay, for 100 beds, 5 pharmacists should be there. Up to 53. Okay, and not likely, more than the 300 beds questions will be asked. Okay, either they will ask up to 50 or 100 bed strength. So remember, it's increasing 3, 5, 8, 50, 100, 200. Okay, next, methods of drug distribution. What are the methods of drug distribution? 4 are there. Individual prescription order system. It can be practiced in big hospitals. How? Okay, because there are hundreds of patients, 250 or 500 patients are there. How can an individual prescription order will be placed for each one of them? Okay, so it will be very difficult to manage. And even if it is we able to manage it, होगा क्या? What will happen is it increase the cost of drug to the patient. Okay, हर कोई तो afford नहीं कर सकेगा. That's why this cannot be practiced in big hospitals. Then the complete floor stock system. The charged floor stock and non-charged floor stock. Charged floor stock is charged only after administration. Okay, that's why it is called charged. And second is the non-charged floor stock for use of all patients. Like all patients, like syringes, vials. These are, I think they come as a non-charged floor stock. Then the dispensing, the drug basket method and mobile dispensing unit. This is a standard dimension. Okay, so you should remember that 60, 48, 25. Okay, this is almost double of this. It's a trick to remember. Combination of both. And the unit dose dispensing system. Then the bedside, you know all of this. Okay, the bedside pharmacy services, no medication other than nitroglycerin. Okay, so this can be a important question. पूछा जा सकता है कि bedside pharmacy में nitroglycerin के अलावा कुछ नहीं होता. Okay, and the current practices committee, responsible for investigation, development and standardization of procedures and requirement. What does this current practices committee do? This is the function. The charge flow stock drugs. Okay, so actually all of these examples are quite important. Okay, so even if in the interview they can ask that which are the commonly used drugs, and you should know brand names of these drugs also along with the dose. But I believe that questions might ask from these only, because these are the most used drugs. तो जो हर किसी का डोज तो नहीं कर सकेंगे हम, राइट, हर किसी का ब्रांड नेम तो नहीं कर सकेंगे, बट एटलीस्ट ये जो इम्पोर्टेंट है ड्रग्स उनका तो करना चाहिए, राइट. So let's start with the antibiotics. Penicillin G potassium 20 mu, procaine penicillin 3 lakhs units per ml, streptomycin sulfate 1 milligram to 2 ml. Okay, so these are the constituent of the charge flow stock. Okay, that's why they are so important. Penicillin and procaine penicillin, and along with the streptomycin, the 2 drugs important. Next one is the anti-epileptic. It is diphenyl hydantoin sodium. Okay. Antihypertensive, which is the antihypertensive use Rezerpan. Also remember the dose also individually. Rezerpan, antihypertensive, which is anticoagulant, heparin, coagulant, protamine sulfate. Cardiovascular agents, which are those? If you want a depressant, procainamide. Antifibrillator, quinidine. Vasoconstrictors, phenylephrine, atenolol, mitarenol bitartrate. Right? All of these are cardiovascular drugs. Procainamide and quinidine. Diuretics, mesaluride. Important one. We can ask which is the diuretic used in a charge closed drug. Mesaluride. Antiallergics, diphenylhydramine hydrochloride and hydrocortisone sodium succinate. Antiallergic. Antinauseant, trimethobenzamide and prochlorperazine. Trimethobenzamide and prochlorperazine. Spasmogenic is bethanyl chloride. Spasmogenic is bethanyl chloride. Next one is which is the tranquilizer is chlorodiazepoxide tranquilizer. Miscellaneous is potassium chloride, mannitol, dextrose. Okay. Next is hospital manufacturing. Hathi Committee on Essential Drugs recommended the setting up of manufacturing units of IV fluids in say 1975. So this can be a question. Which committee recommended the setting up of manufacturing of units of IV fluids? Hathi Committee, right? Next is the sterile manufacturing. Formulation vehicles. Example, water for injection, free from ions and pyrogens. Non-aqueous for intramuscular injection, which are the cottonseed oil, peanut oil, olive oil, glycerine, ethyl alcohol, propylene glycol. All of this can be asked. These are the potential, and ये बहुत ही important questions है, right? Sorry. Then the additives in parenterals. Tonicity, sodium chloride and borax. To adjust the tonicity, sodium chloride and borax is used. Antioxidants in aqueous injections and oil injections. Oily में कौन है? Alpha tocopherol, BHA, BHT, propyl gallate. These are antioxidants used in oil injections. And all other sodium bisulfite, sodium formaldehyde sulfoxylate, thiourea, acetone, sodium metabisulfite, sodium thiosulfate, ascorbic acid, all are used in aqueous injections. Antimicrobials used are cresol, chlorokisol, benzalkonium chloride, chlorobutanol, phenyl mercuric nitrate, benzyl alcohol. Okay, benzyl alcohol is important and benzalkonium chloride is important, right? Stabilizers, inert atmosphere of CO2, nitrogen and EDTA. Okay, CO2 and inert nitrogen you might remember, but also remember EDTA. Buffers, which are the buffers? Calcitrates, phosphates, acetates of sodium, potassium, calcium and magnesium. Wetting agent, twin 80 and sorbitan oleate. Twin 80 wetting agents and sorbitan. Suspending agents, CMC, methyl cellulose, acacia, gelatin, PVP. Emulsifying agent is lecithin. ये क्वेश्चन आता है. This can be a important question. Which is the emulsifying agent? Lecithin. देखो, whenever there are so many examples in a class, बहुत ज़्यादा example होते हैं. So question is not likely to be asked from this. Okay. But even if they ask, they will ask some even important from it or first one, right? But when there is only one example in a class, what I found is that is the candidate for that is the potential candidate for asking question. So don't leave such one-liners. Next is the methods to estimate the amount of adjusting substances required to render a particular solution isotonic with plasma. अगर कोई solution आपको isotonic करना है अपने body के plasma से, तो क्या use करेंगे? What we will use to make it isotonic? Freezing point diffraction method and sodium chloride equivalence. Okay. Next is the layout of sterile product area. लेआउट क्या है? क्लीनअप एरिया विनाइल और इपॉक्सी कोटिंग होना चाहिए. कौन सा कोटिंग होना चाहिए? विनाइल और इपॉक्सी. प्रिपरेशन एरिया स्टेनलेस स्टील. प्रिपरेशन एरिया किसका होना चाहिए? स्टेनलेस स्टील का. असेप्टिक एरिया, गर्मी हो रही बहुत. सेप्टिक एरिया स्टेनलेस स्टील कैबिनेट का बना होना चाहिए. HEPA filters are also important, and laminar airflow speed should be 100 feet per minute. Cleaning of containers and equipment. Containers cleaning, new containers air rinse, new containers को air rinse करना है, right? Thermal shock, no detergent rinse, okay? Detergent rinse नहीं करना है containers को. Thermal shock देना है या फिर air rinse करना है. Only new containers for parenterals. Cleaning machine. What are the cleaning machines? Rack loading washer and cleaning of closures. Rubber closures by hard solution of 0.5 sodium pyrophosphate. वॉशिंग के लिए क्या यूज करता है ना? तो सोडियम पायरोफॉस्फेट. Then manufacture of parenteral. Bacteriological filters, sieves. Which are those bacterial filters? Sieves filter, sintered glass filter, filter cannons. Area of 60 square meters for basic installation. कितना एरिया चाहिए? 60 square meters. The non-reactive materials, which are the borosilicate glass or stainless steel. Ampoule sealing. टिप सीलिंग से होता है एम्पिल और पुल सीलिंग से होता है. तो पुल सीलिंग से जो होता है वो स्लोअर है बट मोर श्योर है. यू मस्ट हैव डन दिस प्रैक्टिकल इन योर diploma or degree. Fast but not sure. Bubble may form due to excess heating. टिप सीलिंग में क्या बबल फॉर्म हो सकता है? ये फास्ट है बट श्योर नहीं है. पुल सीलिंग इज व्हाट? मोर श्योर मेथड, राइट? इन द स्टरलाइजेशन मेथड्स, ड्राई हीट, ड्राई सॉलिड्स, ग्लास, मेटल वेस्ट. ये बहुत बार क्वेश्चन आ सकता है कि कौन से प्रोडक्ट किस मेथड से स्टरलाइज करते हैं, है ना? द मेटल वेयर, सर्जिकल इंस्ट्रूमेंट्स. सर्जिकल इंस्ट्रूमेंट जो है वो मॉइस्ट हीट से है, राइट? द मॉइस्ट हीट एक्वियस सब्सटेंसेस व्हिच कैन बी पेनिट्रेटेड बाय मॉइस्ट हीट. आयनाइजिंग रेडिएशन, ड्राई सॉलिड्स, स्ट्रेप्टोमाइसिन, पॉलीविटामिन, पेनिसिलिन, कैटगट, सूचर. ऑल ऑफ दीज आर, जो भी ड्राई सॉलिड है वो आयनाइजिंग रेडिएशन. गैसियस, इथिलीन ऑक्साइड. syringes, disposable needles, plastic, stainless steel and equipment. Gaseous and ethylene oxide. Bacteria proof filtration. Thermolabile substances are sterilized through bacteria proof filtration. And lyophilization, preservation of human tissues, right? Okay. So let's have a look over this first. Moist heat, factor filtration proof. Alright, so next. We will cover up to this point only in this lecture. The sterility testing method. Penicillin test with penicillinase, sulfur drugs with power. The pyrogen test, also called as LAL test. Limulus acid, limoside something, long form is there, okay. Limulus amebicide lysate test, okay. So US pyrogen test. And actually you should know this entire process of testing of this parenterals, right? First में क्या करते, 3 rabbits receive 10 ml per kg. And पास कब होते हैं वो? No rabbit shows temperature rise of 0.6 degree Celsius or the sum of 3 is not more than 1.4 degree Celsius. अगर इसके कोई भी एक फैक्टर नहीं मैच होता तो 5 additional rabbits given test solution. पास कब होते हैं? If individual rise of greater than 0.6 degree Celsius, है ना? Combined rise किससे ज़्यादा नहीं है? 3.7 degree Celsius. Right? Then only it will pass. तो फर्स्ट में 3, बाद में 5. ओके. लिकर टेस्ट. नेगेटिव प्रेशर इन इनकम्प्लीटली सील्ड एम्पूल. What is the solution used for liquor test? It is methylene blue. Clarity testing. Visual inspection will not detect particles smaller than 50 micrometer. That's why clarity test is used. And 50 particles per 10 ml नहीं चाहिए, 5 particles per 25 micrometer के नहीं चाहिए. Of 25 micrometer or larger नहीं चाहिए. So these are the evaluation of parenterals technique test. Okay, let's stop in this lecture up to here. We'll cover from the next slide in the next part.